Hello, my name is John Thurlow. I'm a physiotherapist working for the Somerset NHS Foundation Trust, and I'd like to talk about osteoarthritis of the hip. I'm going to explain about the condition itself, the symptoms you might experience, and give you some ideas on how to manage these. I'll also talk to you about what exercises can be helpful to keep your hip strong and enable you to continue to do the activities that are important to you. This is a picture of a hip joint. This is the thigh bone, the femur, with its ball and the socket of the pelvis, the acetabulum, that sits in it. There's a ring of cartilage which provides shock absorption and stability in the joint, which we call the labrum. There are also a number of ligaments holding the joint together, and the muscles over the top move the joint and add further stability. Osteoarthritis is a normal process of aging in a joint, just like we see grey hair and wrinkles. Over time, with repetitive loading, the bone surfaces can cause changes within the surface of the joint. Sometimes the joint space narrows, and the ligaments and joint capsule are affected. The hip is a commonly affected site, as it's the joint that deals with a lot of weight bearing and impact. If you look just at X-rays, about 1 in 10 people over the age of 65 has osteoarthritis of the hip. But interestingly, only half of these people complain of any symptoms. This goes to show that what we see on an X-ray doesn't always correlate with the level of symptoms that you might experience, including pain levels. Even if you have some age-related changes, sometimes called degenerative changes, on an X-ray, you can still make significant improvements to your pain and the symptoms of arthritis. The main symptoms that people complain about with osteoarthritis are pain and stiffness. People often tell us that their symptoms come and go, and that they have good and bad days. We also hear people say that their hip is very stiff and sore first thing in the morning, and that it's difficult to get going once they've been sat for a while. In more advanced osteoarthritis, the stiffness can last most of the day. Activities such as spending prolonged periods of time on your feet, twisting, putting shoes on and socks, and walking longer distances can sometimes be challenging. People also mention that they experience sudden increases in their symptoms for no apparent reason. We call this a flare. At the time of a flare, the hip becomes more painful. Activity may feel more challenging, and in some cases sleep can be disturbed. These may occur as a result of change in activity levels, but may not be as a result of anything specific at all, and are just a normal part of having osteoarthritis. They can last up to 4 months, but settle again back to more manageable symptoms after this. We know that these flares don't correspond with any structural worsening of your condition, so you shouldn't be afraid to use your hip even when it feels somewhat sore. Small changes to your activity levels can help avoid irritating the hip in a flare-up. For instance, it might be wise to avoid sitting in lower, deeper chairs when your hip is painful. It'd also be wise not to overload the joint when getting in and out of a car. The best way to start managing hip osteoarthritis is by keeping active. This should involve some aerobic activities like walking, cycling or swimming, as well as some strengthening and flexibility exercises. We'll go into more detail on these in the next section. Sometimes movement or activity can be painful, so it's important to consider what you can do to manage this. Pain relief is an important part of keeping you moving. So if you're worried about masking your symptoms, remember that painful activities aren't actually worsening your condition. It's inactivity and deconditioning of your muscles that may cause symptoms of osteoarthritis to worsen. Being in less pain may make it easier for you to do some of the activities and help you work on your muscle control and joint function. It's important to note that pain and swelling in the joint will stop the muscles from working at their best. People often talk about having a high pain threshold or not wanting to take too many pills, but it's important to be proactive about managing pain and swelling because these factors drive the condition. It's not about whether you can put up with the pain or not. We would suggest discussing your options of pain medication with your pharmacist or GP to decide which might be best for you. Maintaining a healthy weight is also really important for people with this condition. This, of course, is a load-bearing problem, so the bigger the load, the bigger the problem. Losing weight makes a huge difference to how symptomatic your hip will be. However, we realise that it's often hard to lose weight, especially if activity feels painful. There are a number of local services available that can help you with this, and ask your GP or a physiotherapist for advice if you need it. Another option to help you manage your arthritis is using walking aids such as a walking stick or walking poles. These can often help offload the stresses through the knee and the hip and help you stay more active. Good supportive shoes also help absorb some of the shock coming into your hip when walking or running. If you've tried a sustained period of time making adjustments to your lifestyle, strengthening your muscles and managing your pain but are still struggling or having trouble sleeping because of discomfort, we may consider a corticosteroid injection as the next step. For the hip, this needs to be done by guided X-ray in theatre. Since the joint is so deep, this is carried out as a day case. They are designed to reduce the symptoms of osteoarthritis, pain and swelling. They don't improve the condition of your joint in any other way, so keeping up with all the other options we've discussed to manage your osteoarthritis is important. Recent evidence has shown that corticosteroid injections can speed up the progression of osteoarthritis in some people, so it's something to have a careful discussion with your GP or your physiotherapist about. We can repeat the corticosteroid injection into the hip, but evidence suggests that it's only safe to do so 4 months apart with a maximum of 3 a year. We tend to find the more often we do them, the less effective they tend to be. The next step in our options to manage hip joint arthritis would be to consider some form of surgery, but this is by no means inevitable for someone diagnosed with osteoarthritis of the hip. As mentioned, exercise, staying strong and flexible is the best way to look after hip with osteoarthritis. The muscles around the hip add stability to the joint and keep these in good condition to protect your hip. Regular movement keeps the joint well lubricated and stops it from becoming too painful. Some activities are more irritable than others, so it's worth exploring your options and choosing sensibly. Unfortunately, if running gives you a flare of pain and you struggle with it for the next week, it's probably not the best choice for you at this time. Perhaps you can choose some other activities for your good weeks and save gentler, low-impact activities for flares. There are so many different options available: cycling, swimming, dancing, gym work, exercise classes. It doesn't matter what you do as long as you're consistent. The recommendation is that you should be working towards achieving 150 minutes of moderate exercise each week and strength exercise at least twice a week. So really finding something that you enjoy is probably the best recipe for success. Here are some ideas of exercises that you can do at home.
Knee hugs. Lie on your back, pull your knee to your chest until you feel a stretch. Hold for around 30 seconds and then relax. If this is too painful, just slide your heel as close to your bottom as you are able. Marching. This is good to do on both legs, but if you find it uncomfortable to stand just on your sore leg, just hold on to something and lift one knee up to 90 degrees and then lower. You could do this sitting down if you struggle. Hip extension. Hold onto something if you need to for balance. Squeeze your bottom and lift your leg out straight behind you. Make sure you stay standing upright. Keep going until you feel that the muscle is tiring out. Hip abduction. Turn sideways and lift your leg out to the side. Again, make sure that your trunk stays upright. You can make both of these exercises harder by holding the leg out for longer whilst you contract the muscle. Bridging. Lie on your back, breathe out and squeeze your bottom to lift your pelvis up. Breathe in and gently lower. You can make this exercise harder by holding for longer or by using one leg at a time. Squats. Standing up straight, bend your knees and push your bottom backwards as though you were going to sit on a chair. Squeeze your bottom and stand up. You can make this exercise harder by holding a weight at your chest or in each hand.
We hope you found this helpful. Your GP or physio can help you with any further advice or guidance, and we recommend the NHS website and the Versus Arthritis website. Thank you for watching.